Good morning, everyone. My name is Amy Porter. I'm from Earth University. I'm a professor here. I'd like to welcome you to the session titled Multidimensional Poverty and its Relationship with Catastrophic Healthcare Payments, Evidence from 8 Low-Middle Income Countries. I'd like to remind the attendees that your microphones and cameras are automatically muted throughout the session. To ask questions of the presenters, please use the question and answer tool located in the tool ribbon on the right side of your screen. We encourage you to chat with your fellow attendees using the chat feature, also located on the right side of your screen. One last thing I would like to draw your attention to is the slider bar beneath the video and content windows, which allows you to adjust the size of each window for a better viewing experience. If you experience any technical issues during the session, please describe the problem in the moderator chat located just beneath the primary chat, and a member of our support team will be happy to assist you. There will be about 30 minutes of content, and then we will have time for questions and answers. I would now like to present to you our presenters. We have Mónica Panilla Ronzanillo, Assistant Professor at the Universidad de los Andes, and we also have with us Paul Rodriguez Lesmes, Assistant Professor of School of Economics from the Universidad del Rosario. Welcome, everyone.
Thank you. Okay. Thank you, everyone. Thank you, Amy, and thank you, everyone who is attending. So I'm going to share my screen. Just 1 second. Okay. Okay, can you please confirm that you can see my screen? Oh.
Yes, we can see.
Yes. Yeah. Okay. Thank you. Thank you, everyone, and welcome to this morning session about catastrophic spending and multidimensional poverty. This is the results of a research project that we have between 3 universities here in Bogotá, Colombia: Pontificia Universidad Javeriana, Universidad del Rosario, and Universidad de los Andes. There is 6 researchers that belong to this research team, and 2 research assistants that are the ones who are managing most of the problems with the data. So we are we're really happy to be here and being able to present these results. So first of all, I want to start with a poll and asking you several questions, or a couple of questions related to what is catastrophic payment, but most important, what are the indicators or the SDGs that are related to catastrophic expenditures and multidimensional poverty. So if we can start with the first poll, please. And I just want to check in here. Can we start with the first poll? The first poll is which is a SDG related to poverty. So if you can please vote, we have 4 options: SDG number 1, SDG number 5, SDG number 10, and SDG 17. So if everyone in the audience can please vote which is the SDG that you think that is related to poverty, we will really appreciate it. Okay, so now I'm going to go back to my screen. Okay, so let me talk a little bit about those SDGs. So some of you will know that the SDG that's related to poverty is the SDG number 1. That is end poverty in all its forms everywhere. And SDG number 1 has different targets and different indicators inside that SDG. And one of those indicators is the SDG 1.2 or target 1.2 that says that we are going to reduce poverty in all these dimensions, and that recognizes that poverty is a multidimensional aspect. And it's the first time in the history of the SDGs or the NDGs that multidimensional poverty is recognized as an important aspect or in the process of poverty reduction. So SDG number 1 is the one who is related with poverty. And when we talk about the SDGs related with health access, we are going to talk about the SDG number 3. And SDG number 3.8 is the SDG that aims to achieve universal health coverage, including financial risk and protection, access to quality essential healthcare services, and access to safety, efficient, and quality and affordable essential medicines and vaccines for everyone. In this case, for us, what we aim is to analyze what is the relation between those problems in access or in getting healthcare access and the risk of poverty. So with this in mind, I'm going to explain a little bit about what is catastrophic expenditures and how those catastrophic expenditures relate with multidimensional poverty and why we are here explaining these and how these relate with SDGs and these targets for the new targets of development. So the first that we need to understand is that catastrophic expenditures is all the financial risk that people will suffer. So there are people around the world that have healthcare coverage and that are covered with an insurance, and there are some other people around the world that don't have this access to coverage, or that they are facing the risk of become sick and therefore become poor. So why people become poor? Because of catastrophic expenditures. So what happens is that there are families that face the shock. So any other member or any member of the household will become sick. And because they become sick, what they are going to face is the decision between having to give health care to the person, and the other thing will be to sacrifice some part of the consumption in the present or the wealth and the consumption in the future. So this is a decision that hundreds of thousands of people around the world are facing daily. And because of that, catastrophic payments or healthcare expenditures are one of the main reasons for people to become poor and being in a poverty camp. So this is really important. And sometimes the existence of healthcare insurance can work. So sometimes they say, okay, you have a healthcare insurance, but sometimes just having healthcare insurance doesn't guarantee that you have access to healthcare. And in that case, people still face that decision and that hard decision between what I'm going to do. I'm going to provide healthcare to the person who I love, who is sick in my family, or I'm going to continue constant having expenditures in another aspect. There are different research, especially qualitative research, that says that healthcare expenditures is one of the most important aspects that increases the risk of poverty for people around the world in any country or in any country, not matter the development of the country. In this case, it's really important to understand why is this, how this relation has become. So some of you will know Breaking Bad, this TV show that was really famous in 2008 and lasted for 5 or 6 seasons, I don't remember. And Breaking Bad was about this guy who was a professor, chemistry professor, a teacher in a high school. He was really decent and he was dedicated to his family and his job. And he was really happy with his life. And one day he was diagnosed with cancer. And this was a shock for his life because he had a huge amount of bills to pay in order to be able to receive the treatment that he needed in order to survive. So he found a chance to become a new business, that it was not legal business. And because of that, that was the whole story and the 5 or 6 seasons of Breaking Bad. So in here, what we see is, as this professor of this TV show, there are thousands of people who are facing that. Some of them have the chances to become, to get access to healthcare using different healthcare insurance or regimes, and some of them don't have that access. So that's really important to keep in mind. So we are going to define catastrophic expenditures as all the out-of-pocket expenditures of a household that are around or more than 40% of the disposable expenditure. This means after you take the expenditures of the household in food consumption, food, you are going to account if the other of the healthcare expenditures correspond to 40% or more, then the household is in catastrophic expenditure. That other definitions and that definition related with income or this definition related to expenditures, we are going to use this one related to expenditures because it's the one that's available in our data. So just to okay, so we know that reasons that people become poor, but what the evidence say about it? So there are different reviews about the link with poverty and catastrophic healthcare expenditures on poverty and how people are reacting to or what are the actions that people take or the decisions that people take in order to overcome the shock. But the evidence is a little bit not conclusive. And why is not conclusive? Because households usually don't only take the decision based in one option. It's not like, okay, you have health or you have consumption in food. But households usually have different strategies to reduce the impact of these shocks. So when you analyze only income poverty and you analyze poverty just from a monetary perspective, so the results of the different analyses show that maybe that the shock is not as strong as you would expect. So we know why, because anecdotal evidence and qualitative data tell us that this is a huge shock, but what quantitative data and empirical data analyzing the impact of this shock in poverty show us that it's not as big as we will expect. So there are a couple of things that are missing, and that is the gap of the knowledge that we want to fill. The first one is that most of the studies use cross-sectional data. So they are only based on what happened in one moment of the time, and it's just like a picture that they are analyzing.
Okay, but I can follow up a bit when he get back, when she get back. Basically, so here we're talking about this link between poverty and the catastrophic payments and poverty, right? So I will share my screen as well, so we don't have any.
Hey, can you hear me?
Yes, we can hear you, Monica.
Yes. I don't know what happened. I was just talking. Sorry. I'm almost done, and you can continue. That's okay?
Okay. Yeah, it's perfect.
Okay. Sorry.
Screen. Right. So, can you see my screen now?
Yes. Okay. So, okay. Sorry for that. I don't know what happened. So what I was saying is that there is a missing point in related especially with the longitudinal studies. And when we are analyzing poverty from a multidimensional perspective, we realize that poverty is a little bit more complex than just having access to income or consumption. In that way, there is only one study that studies the relation between catastrophic payments and multidimensional poverty using cross-sectional data, and especially for Myanmar, Nepal, and India. So when we are analyzing, next one please. When we are analyzing multidimensional poverty from a multidimensional perspective, we are recognizing that poverty it goes beyond just having a little bit more than an imaginary poverty line. So we have different poverty lines that explain or says that poverty is having more than $1.9 per day. But these poverty lines don't cover or don't account for the complexity of poverty. And according to Martin Sen, that is a Nobel Prize in economics that has been the leader of the capability approach, what we are analyzing here is that poverty represents when a person cannot cover certain basic needs. Which are those basic needs? It will depend on the context, and it will depend on the needs of the person. And the important thing here is to be able to have the capacity to choose the life that you want to have and to choose the person that you want to be. Based on this idea of multidimensional poverty, the Algarve-Foster method was developed. And the Algarve-Foster method is the method that is more commonly used now to develop multidimensional poverty index. And we are going to use the Algarve-Foster method in our research to analyze the relation between multidimensional poverty and catastrophic payments. Next one, please. Following the Algarve-Foster method, we have different multidimensional poverty indexes. The first one and the most popular is the Global MPI. The Global MPI is an index that is published since 2010, in the Human Development Report, and it's a collaboration of the Oxford Poverty and Human Development Initiative and the UNDP. So what we have done in here, or what I have done in here, is to create an index that includes 3 dimensions and 10 indicators, and analyze the multidimensional poverty at the household level. So in here, what we're going to do is that we are going to compute a measure that considers the privations at the household level and individual level, and it's not only an aggregate measure. So based on that, we are also going to create a different MPIs in the countries that Paul will explain a little bit better. And in here, what we are going to do, next one please, is to try to incorporate different indicators of different SDGs targets inside the MPI. So the good part of the MPI is not only that it allows you to measure multidimensional poverty, but also it allows you to analyze how the different deprivations in different indicators that can be related to catastrophic payments are going to move over time and are related to poverty. For example, we have school attendance, or we have food security, or we have access to education, or access to clean source of water, or access to sanitation or electricity. All those indicators are related with different SDGs, and usually most of the MPIs are related to 8 to 10 SDGs, depending on the number of indicators that are included. Therefore, when you create an MPI, you're not only analyzing multidimensional poverty, you're analyzing other deprivations, and those deprivations in most of the time are related to those coping mechanisms that households have in order to avoid that the shock of the healthcare expenditures will reduce their consumption of food or basic items. So with that, I'm going to give the word to Paul, who is going to explain what we have done in the project. Paul, I cannot hear you.
Can you hear me?
Yes, now yes.
Okay, perfect. So which is the objective of this project, as Monica was saying, is to establish this relationship between catastrophic health expenditures and multidimensional poverty for the case of low and middle income countries. So in order to obtain this main objective, we have 4 steps. So the first one is to determine the factors that influence the likelihood of a household being poor. Essentially, we want to know which characteristics are usually associated with the multidimensional poverty and catastrophic expenditures. That's the first part, and normally this comes from a review on the literature that we are going on and going through different surveys. The second is to identify and classify the mechanisms of households to cope with this case of high levels of health expenditures. So again, we go into the literature review, see what's going on, and again, analyzing that what happens in each of these countries. So some of the countries that we are analyzing, so for instance, Chile has specific institutions that are designed for dealing with high cost diseases. The case of the Ley Ricarte Soto allows the health system in Chile to treat anyone, to provide free access to diagnosis, treatments, and in general services related to specific conditions who are normally too expensive for the Chileans, regardless of their health insurance. So trying to understand this type of institutions behind is certain in order to understand what we will get into empiric analysis. Third, we compare the level of catastrophic spending, the mechanisms for dealing, and similar among the 8 countries. Which are these 8 countries? So we identify before starting that the case of Colombia, Uruguay, Chile, and Mexico in Latin America, and Uganda, Malawi, and Tanzania in Africa provide a good setup because we have information, at least at that moment we knew that we have some longitudinal surveys that we can work with this, where there are information about health, and there is some information about poverty and expenditure. Then with time we realize that in some countries it's not possible, so we are changing this a bit. But this is the initial step for this goal. And the last one is to propose policy recommendations to reduce or mitigate the levels of catastrophic spending. This comes from this comparison, which we are comparing data from our quantitative analysis with our analysis on the health systems of the 8 countries. So, okay, so as I was saying, we're using 8 countries. So what we do is a longitudinal study analyzing changes on multidimensional poverty. With the existence of catastrophic payments, it will be a little bit clearer when we observe the results and how we interpret them. And at this moment, we have worked with 4 countries, and we're going to present you 2 of them, Uganda and Mexico. So for some other cases, so we're saying 4. Why 4? So for instance, we have analyzed the case of Chile. We have gone through all the data sets available, thought about this ley Ricarte Soto and similar. But then when we realize on what is available in the data, at the end, we cannot really use that for applying our methodology. So part of the result that we're going to write at the end of the report that will be available at the end of the project is which countries we have considered and why we were not to be able to do the analysis on some of them and why we have included some others. So for these cases of Uganda and Mexico, we have analyzed health expenditures and how catastrophic payments are associated with changes in multidimensional poverty, right? So let's see a little bit the results to understand what's going on. So first, this is the case of Mexico. So we have 3 years in this survey. This is the Encuesta Nacional sobre Niveles de Vida en Hogares, which more or less the national survey of quality of life of households. And what we observe in the graph on the y-axis is the multidimensional poverty index. It goes from 0 to 100%. This is the percentage which ends up being classified. So what happens here? What we have is that the proportion of households that are classified to be with multidimensional poverty, if the households have received like a health shock that makes them to do catastrophic payments, essentially is what we can observe in this part here, is 24.5%. For households without a catastrophic payments, it's 19% in 2002. Next wave, we have 2006, more or less the same, 22, 19, so 3 percentage points. And 2012, we see this difference to get larger. The question is, does these cross-section differences that we observe here are really related to what happens to a family? That means that there could be some other characteristics that make you prone to be in poverty and at the same time make you more likely, for instance, to suffer from a catastrophic payment event. And we need to reduce this potential confusion from the analysis. If we go to Uganda, where we use the Uganda National Panel Survey, this is more or less the same idea. So in the cases where we have catastrophic payments, the incidence of multidimensional poverty is larger than for the cases without catastrophic payments in all years, right? There are some differences here, as Monica was saying. If you go and see what is the incidence of poverty or multidimensional poverty using the global IPM, it's 67% in Uganda. If we get back for Mexico, it's just 6%. But if you go and see the Mexican statistics, it is 43%. So one goal of this comparison within these countries is to try to have a poverty index that it's comparable across countries, but at the same time is sensible enough to observe the changes that we expect due to catastrophic payments. So the basic IPM global have a very few characteristics of as Monica was saying, and some of them might respond or not to specific events related to catastrophic payments. For instance, we were thinking about the material of the dwelling or the overcrowding of the household, for instance. These 2 characteristics might not really react to a catastrophic payment, but some others, like for instance, if the family has work or there is a work, someone is working more or less, and getting an income. For the case of Latin America, if this work is formal, that means that you are getting access to health insurance and specifically to pension and retirement funds. These are other characteristics that are included in these cases. So we are shaping a little bit the definitions, and we will play with several versions of the definition of poverty and of multidimensional poverty and of catastrophic payments to assess not only these correlations that we're showing here, but also this more causal relationship between the incidence of a catastrophic payment and multidimensional poverty index. So let's move to the regression analysis and go on to understand what's going on here. Let me use this 1 second. So basically what this table is saying is if a family receives a shock, say, in period t, or between t and t plus 1, say t minus 1 and t to be consistent just to what we have here, we want to observe how it changed the probability that it is reported a household to be in multidimensional poverty for the case of Mexico and Uganda. So this comes from a linear panel estimator with two-way fixed effects. Basically, it could be that you don't have a catastrophic payment in t minus 1, but you have it in t. So if that happens, we want to see if there is a change on whether you are classified as poor and not poor. But the opposite also happens. You don't have a catastrophic payment event, or you have a catastrophic payment event in t minus 1, but it's not longer present in t. We also use this sort of variation to understand if there is a change in poverty, right? So if we use both sources of variation, we are getting that there is an increase in 5 percentage points on the probability that the household is reported to be under multidimensional poverty. We can split the two potential channels and say, okay, let's consider a household that didn't have a catastrophic payment and now does it have it, which corresponds to this line. And we see that the effect is stronger. So now it's not 5, but it's 8 percentage points for the case of Mexico. If we go into the other channel, you did have a catastrophic payment, and now you no longer have it. It doesn't change, no? Which is these 2 percentage points, but we cannot reject the hypothesis that they are the same, that they are equal to 0. So this is telling a very important conclusion, at least for Mexico at this moment. And it's basically that these catastrophic payments have an impact on the families, but once you lose them, it's not that you revert back to the initial status. They have permanent impacts on the family. We can also try to use this type of reasoning to understand whether it really makes people to go into poverty or if it essentially keeps more people in poverty for longer. So this first line, basically saying we will consider only people who were not poor in t minus 1, and they have a catastrophic event in t. So what happens? Basically, nothing. So if you were not poor in t minus 1, then you are not sent into poverty because of a catastrophic payment in Mexico, which is interesting. It says that actually the characteristics of the health system of Mexico are preventing these households to go into poverty because of events. But what it does is that if you are poor, it avoids you to get out of poverty. So what you observe is that households that were poor in t minus 1 in period t are still poor, and it's more likely that they keep in poverty. So essentially, catastrophic payments become a poverty trap for these households in the case of Mexico. How we can, 6 percentage points is something big, is small. So basically, it's the same impact of a household to suffer unemployment. Basically, if we observe that there is an unemployment shock for these households in period t and they were employed in period t minus 1, it means that the same level of poverty coming from this event is also more or less coming from a catastrophic payment event. And in
Paul,
general,
I'd like to say we have about 1 more minute.
yeah, this is the last slide. So
Perfect.
So in terms of the disease shock, basically it is not that this entire 8 percentage point or 5 percentage point, depending on whether we're looking here or here, come from the household being sick. So it is not a productivity impact, if you want, because a disease shock in general, this is the diagnosis for chronic disease. It just makes people in going or reporting the variation or reporting to be multidimensional poor is just 3 percentage points. Whereas here we observe it to be at least twice or more the impact of a catastrophic payment. So this is on top of the productivity shock of health, we have a financial impact over the household, which come from then selling assets and other characteristics. Okay, so those small details we will detail later, and not for today, because as you have seen, we don't have more time. What happens for Uganda? For Uganda, we don't observe anything. Basically, the levels of poverty that we compare in Mexico and Uganda are quite different. And they are also part of the definitions of what it means to be poor in Mexico and Uganda. So what we do here as well is to try several definitions, as I told in the past, of poverty and catastrophic payments to see how these shocks that we are observing here change according to the definition. Basically, in Uganda, like there is no general impact because the levels of poverty are too high already. So catastrophic payments doesn't change the basic levels of the general rural population that is this survey. Whereas in Mexico, it really makes a difference. So we need to understand better what's going on behind. So, okay, so that's everything. This is our team, Monica, who was presenting some minutes ago, and it's our principal investigator, myself, and Carlos Sepúlveda from Rosario University, economist, Janet and Angela, they are from Javeriana, and Andrea and Catalina from Universidad de los Andes. We also have our two data monsters, Gustavo and Juan Jose, research assistant, and a team of undergraduates who are learning about health economics and SDG at the same time, while they help us a little bit with the literature review and other elements. Many thanks.
Thank you very much, Paul and Monica. At this time, do we have any questions from the audience? You can use the Q&A function. We don't have any questions at this time. I have a question if you're continuing to do this with other countries or?
Yes, so the idea now, once we have finished the analysis for Uganda and for Mexico, basically is to move into the other sort of countries. In this moment, we're analyzing Colombia, so for which we have the Encuesta Longitudinal de Colombia, which is also a panel for 2010, 2013, 2016. And we're analyzing now the case of Malawi. The good thing about Malawi is that Malawi has several studies related to catastrophic payments and health already. So we can really compare one-to-one the results that we were getting to the results that are already in the literature. Then we will go into Tanzania and into Uruguay, and we're discussing if we will go into India. That also has a good panel survey.
Okay, thank you.
Maybe while people get to have some questions for us and using the last minutes that we have, we can tell you a little bit more about the implications of these results in the SDG achievement, especially those in the 3.8. I don't know if that is possible.
Yes, you can have about 2 minutes. That's great.
Yeah, it's just like for us, it's really important to have this because it's the first study, as we were mentioned, that it uses multidimensional poverty and it uses longitudinal data and analyzes this. We were a little bit surprised about the fact that in Uganda we didn't find anything that was significant. But once you start analyzing, and as Paul was mentioned, you just realize that people in Uganda, they're facing so much poverty, or the levels of poverty and deprivation are so high that the strategies that they are taking in order to overcome the impact of these shocks are different to the ones that we can see in Mexico, and probably they are risking more their decisions, that they are taking different decisions, not only regarding, for example, to take children from a school or selling their assets, but maybe more decisions that are more difficult to capture with a measure. And this has important implications in this objective of a universal healthcare coverage without financial risk, because this means that even though when you have a system that covers different services, people who are in extreme poverty, they are facing hard decisions, and usually they might not be taking the decisions to defend or to prevent or to prioritize health, and they are taking the decisions to prioritize another like consumption or another aspects of their lives, and that becomes quite an impressive and interesting finding that we will need to go deep in order to understand why in countries like Uganda that the levels of multidimensional poverty are so high, but also that they are facing catastrophic payments. We cannot see these changes on their levels of poverty.
Thank you. Well, at this time, I would like to thank you, Paul and Monica, for this interesting session. Thank you for the attendees for being here with us, and also for the UGC organizers for this event. This session will be recorded, so you afterwards will be able to have access to it. It will be shared. Thank you so much. This concludes our session, and have a wonderful day.
Okay, thank you.
Thank you. Bye.